How my sister treated her mild acne to save her marriage. You don't have to live with scars, acne, and other skin problems you may have. My sister is a living testimony. She had this mild acne for over 3 years and she was almost losing grip of her marriage as her husband soon became irritated with her skin condition. As a matter of fact, he stopped getting close to her and most times would keep late nights. This continued for some time until my sister was able to crack the code that let her free from this mild acne. Today she lives happily with her husband and is now happy with her new look, except that the hubby's only regret was for him not to have given his wife the lovely support and encouragement she needed in her trying moments. In normal functioning skin, the follicles of the sebaceous glands secrete sebum into the pores. The sebum and dead cells then shed from the stratum corneum, the outermost layer of the epidermis, by emerging from the pore opening to the skin's outermost layer. When someone has acne, this process goes haywire. The sebum and follicles mix with P. acnes, a bacteria that is found on the skin. The accumulation of these things sometimes form a mass in the follicles which partially or totally plug them up. The follicle obstruction is called a lesion. The severity of the lesion, compounded with the added characteristic of being inflamed or not, determines the type of acne it will develop into. It will then either erupt in the epidermis or beneath the skin surface in the dermis. Treating mild acne. Treating mild acne, commendo blackheads. So we will start with the mildest forms of acne. The mildest type of lesions are called commendo. Treating commendo fall into two categories: treating the blackheads and whiteheads. It is very difficult to keep our hands off of blackheads. It is possible to remove them ourselves, although we have to be very careful when we do. The first thing you want to do when treating any form of acne is to wash your face with warm water with a cleanser appropriate for your skin type. Then, you want to apply a moderately hot compress to the blackhead to loosen it. Contrary to belief, gently removing blackheads actually can help and prevent further damage to your skin. Although squeezing can cause scarring in general to acne, if you know how it can be effective in removing blackheads. Apply a warm compress first to the blackhead. Then gently with your fingertips, not nails, remove the blackhead by squeezing either side of the blackhead after applying the heat so it can pop out easily. If it doesn't pop out after the initial try, then you may have to apply heat several times to loosen it. Squeezing should be gentle and not leave any marks. If after squeezing the blackhead it does not pop out, then you may want to try exfoliating your face to loosen them. Use an exfoliating product that is appropriate for your skin type. A medicated one with benzoyl peroxide is ideal. Today on the market there are also metallic extractors that you can buy, like you buy tweezers to help you remove blackheads. A metallic extractor is a little device made out of a metal similar to tweezers with a small round opening on the end. You can literally unplug a blackhead with it, but be careful of causing scarring. If you have blackheads on your nose, they have blackhead strips for that. Drink lots of water and avoid oily foods. If you use makeup, make sure it's a non-oil base so as not to continue to clog the pores. If all else fails, you can opt for microdermabrasion. Commendo whiteheads. It is not recommended to squeeze whiteheads. When you do, you release the bacteria, dead cells, and pus into the pore, creating a full-blown infected pimples. This is also inviting scarring. There is a method to pop a whitehead, but you have to know what you are doing first. To pop a whitehead you need a clean cloth. A white washcloth that is cotton is ideal, a new sewing needle, some sterile gauze or cotton balls, a bottle of alcohol and a bandage. The first step is to thoroughly wash your hands with an antibacterial soap. Then wash your face. Now pick up the clean cloth and immerse it in hot water. When it is thoroughly wet, squeeze out the excess water and put it on the whitehead for a few minutes like you would do a blackhead. Sometimes this is all it needs to make the whitehead ooze and you are done. If the hot rag doesn't do the trick, then sterilize a new needle in alcohol and very gently prick the head only of the whitehead. Do not dig the needle into the pimple, just the top, to promote oozing. Once the whitehead is punctured, you put cotton wipes on either side of the whitehead and gentle apply pressure until either blood or clear fluid comes out. You just got rid of the whitehead. Lastly, gently wipe the area with alcohol and a sterile wipe, and then you can cover it with a bandage. The reason for this is because when the whitehead breaks, you are risking the spread of bacteria to other areas of your face. If you don't like this method of whitehead removal, use cleansing products, toner, and then a lotion with benzoyl peroxide to let it break and heal on its own. Mild acne. Mild acne usually consists of whiteheads, blackheads, and papules that can turn into pustules. When treating at home, it can take from 4 to 8 weeks to see a great improvement. The reason benzoyl peroxide is recommended is because it kills the bacteria that causes acne. You have to be consistent to keep acne under control. Regular soap and water is not the best facial cleaner for acne. You want a natural or medicated mild to strong, depending on the severity of the acne, facial cleanser. It is recommended to wash your face twice a day. Like I have stated before, it's best to use a cleanser and products that are appropriate for your skin type. After washing your face with the cleanser, you want to rinse it 10 to 15 times, letting it air dry or patting it dry, not rubbing with a clean cloth. You want to use a facial cleaner with low-level benzoyl peroxide for mild cases of acne. Topical retinoid products seem to help acne outbreaks also. Astringents and toners are very good to use after washing your face because they clean and close the pores. They also reduce the amount of sebum that is produced, which affects acne. If you want to use a moisturizer, do not use an oil-based one. There are some moisturizing products that are designed especially for acne-prone skin as well as medicated ones. It's best to apply a moisturizer while your face is damp because it absorbs it better when wet. If you use makeup, apply a medicated toner beforehand if you have acne problems. This way you can control a buildup of sebum under the makeup, which can further clog the pores. Body acne. If you have body acne, you can use a medicated cleanser on your body as well as a cleanser for oily skin. The rule of thumb is you want to use the same type of cleanser on your body that you use on your face, because chances are you have the same skin type all over. If your facial cleansers are costly, then a good antibacterial body soap that is appropriate for your skin type is a good alternative to bathe with. After bathing, you can then apply benzoyl peroxide lotion to that part of the body afflicted with acne. Back acne is not the same as facial acne and is tougher to treat in general. Although acne on the back is caused the same way as facial acne, with excess sebum and dead cells trapped in the follicles, the skin on the back is tougher. Also, the sebaceous glands are larger in the back. The fact is that because the glands in the back are larger means more production of oil on your back. This means with back acne you get nodules and cysts sometimes due to this reason. Because the skin tends to be tougher, you have to use a maximum strength product in this area. Irritation is another factor with back acne. Clothes rubbing on the bumps irritate them and make them worse. Back acne is more resistant than facial acne. You have to treat back acne very aggressively to get any results. You also tend to get scarring because there are cysts and nodules that develop on the back. It's good to have a dermatologist look at your back to suggest what can be done to prevent scarring. Other treatments. Exfoliating is good to do a few times a week, but never on inflamed acne or active pustules. If you have an inflamed outbreak, wait until the pustules heal and then exfoliate. There are medicated and acne-prone exfoliators that suit various skin types. Likewise for medicated and natural facial masks, which can also help control acne. Herbal steams can also keep the pores from collecting debris. There are chemical peels that you can buy over the counter with salicylic acid and glycolic acid. Do not use these together. Retinoid products. When acne is serious. For more serious acne, you need to see a dermatologist. Do not attempt to try and treat serious acne yourself. It can make things worse. There are times when antibiotics and other medications are prescribed by dermatologists. Antibiotics are used to reduce the bacteria and inflammation in infected acne. Sometimes oral medications are given. This is so the medication is carried throughout the bloodstream to all of the body's systems, thus, it is a systemic treatment. Oral medication can be useful when acne affects the skin on multiple areas of the body. Tetracyclines are the most common antibiotic used for systemic treatments. Systemic treatments are used for short periods because of the resistance to antibiotics bacteria develop. There are a lot of concerns with antibiotic treatment of acne due to side effects. Another oral treatment is isotretinoin, or retinoic acid, Accutane. Accutane is effective in about 2/3 of the patients who use it to treat more severe cystic acne. It is also used for acne that is unresponsive to other treatments. Its main side effect is body dryness. Sometimes hormone therapy is given in conjunction with acne treatments to restore hormonal imbalances that cause acne in men and women. There are topical antibiotics and sulfur drugs given to treat acne also. Erythromycin, clindamycin, and sulfa drugs are some of the effective topical medications that can be applied directly to the lesions and so have less possibility of side effects. But, one disadvantage of topical medicines is that due to increased usage, the bacteria often develops tolerance and resistance, making them less effective with constant use. Vitamins. For those who are into natural medicine and healthy alternatives, there are vitamins to help with acne that one can take. It has been also shown that acne can improve with vitamins. The first vitamins used in a fighting acne regimen are vitamins A and B complex. They not only improve acne but help to maintain skin. Vitamin B5 definitely is one to use for helping to clear acne and maintain good skin. It is recommended that B5 be used in conjunction with a cream that contains 20% pantothenic acid by weight. The cream should be applied 4 to 6 times a day. Vitamin B6 helps regulate hormones and vitamin C helps the immune system and promotes healing. Both are good in helping to keep acne breakouts down. Vitamin E and zinc are also good to help clear up an acne outbreak. Zinc promotes healthy skin and healing. Vitamin E clears skin of outbreaks and helps maintain healthy skin. If you use vitamin E for skin purposes, it is recommended that you take 200 to 400 microgram of selenium because it boosts vitamin E's effectiveness. When using vitamins, you can see if all or a combination of them work best for you. It takes at least between 2 and 4 months to see the effects of vitamins working for you to help clear and keep your skin healthy.